Hello, folks. Welcome to Ramban. Today, I am going to discuss about Itraconazole. So, the pronunciation is Itraconazole. It is not Itra. It is not Itra. It is Itraconazole. The content, it is from the triazole class. Okay, the function, it inhibits ergosterol, which is a component that forms the cell membrane of the fungi. Okay, so itraconazole inhibits from the growth of this cell membrane, eventually disintegrates it, causing its death. Okay, now dosage, I'm going to discuss about the dosage because every other infection has its own dosage. Okay, limited to the type and the severity of the infection. However, generally, on general basis, the dosage for an adult, as per the severity, if the severity is high, then for the first 3 days you can administer 200 milligrams of itraconazole BD, that is twice a day. All right, and fourth day onwards it is OD, that is once a day. And for children, pediatrics, okay, it will be 200 milligrams, okay, but it will be 5 milligrams per kg per dose by mouth. All right, and we can prescribe it for twice a day. All right, and okay, the symptoms or the infection, some of the examples of the infection that wherein we prescribe itraconazole, that is blastomycosis, histoplasmosis, tinea versicolor, onychomycosis, and esophageal candidiasis. Okay, and there are many other. Mostly this is the latest drug that we prescribe for almost all kind of fungal infection, along with some supplementary drugs as well, which I will be discussing, okay, later. The fungal infection where we prescribe itraconazole, they are the fungal infection in the lungs, mouth, throat, vagina, nails, and also some erupting infections on the skin. Dietary supplement. Now, this is one of the most important components where when fungal infection comes into picture. We have to be a bit cautious about diets. We have to avoid oily foods and specifically foods that we get it in the on the streets by hawkers. Okay, make sure that you are having clean, pristine foods. Okay, and itraconazole works well when there is a good amount of citrus intake. For example, oranges, lemonades, mojitos, etc. All right. And the side effects. This is also one of the very important component. We have to be always well aware of the side effects of this uh, of any drug rather. So side effects of itraconazole is nausea, abdominal pain, headache, rash, diarrhea, and liver problem. So sometimes, okay, if patient is going through some abdominal pain, most often it is observed that patients get abdominal pains. Okay, so we also provide some prozole family, that is pantoprazole or omeprazole, okay, that helps reduce the abdominal pain or any kind of acidity forming components. The other factors supporting medication, apart from the medication, the drugs, itraconazole that we take by mouth, PO, all right, we also can provide topical ointments such as the azole family, azole antifungal family, which is 1% of W by W concentration. At the moment, liliconazole is one of the best ointments available. Okay, it works very well. Okay, now, one important component that we all need to take into consideration: most of the patients tend to stop the course of this medication once it appears that it is healed on the surface level. So that should not be the case. You have to complete the course. That is very important. The course is for 2 to 3 months, and it is imperative for all the patients to complete the course because our skin is made of layers.